Psychotherapy, psychology or psychiatry, that is the question. That's the question my father asked me when I told him as a medic student that psychiatry was the one branch of medicine that really fascinated me. I wasn't going to go into general practice or join the family surgery. In retrospect, what he said to me, he was a dick. Now what's happening is the private sector and the independent sector in the provision of mental health is the big multi-conglomerate insurance companies. You know who they are. These bastards are engaging into mental health services by engaging with treatment, not profession. So the patient rings their insurance provider. The insurer says, yes, we'll sort that out. We'll give you 6 sessions of cognitive behavioural therapy. And that's become the policy, CBT. That'll be provided routinely by a counsellor to force the prices down. Now, as psychologists and psychiatrists, you could argue we're overcharging. £120, £150 an hour. A counsellor will be getting something like £50 an hour. And then there are charges on top of that which go back to the filthy rich bastards' back pockets. It's shocking. Recently, I saw a patient who, after receiving 6 sessions of CBT from a counsellor through her insurance company, was referred to me. I got hold of the clinical notes from said counsellor, and the advice after 6 sessions, and no word of a lie, the patient was given a little blue bag with stones in it to take away to make them feel better. The idiot counsellor left the notes and the actual cost of the session. The counsellor had been paid 60 quid, but the cost through the third-party insurance was 190. That's shocking. I see all of this as a demise of the profession. How do you determine the difference if somebody says to you, I do psychology, as opposed to someone who says, I'm a clinical psychologist? It's farcical. You look at the way people describe themselves, what their job title is, it's hilarious. There are the most amazing names. I googled this myself the other day. I discovered counsellors in Newcastle going by job titles psychiatric technician, problem wrangler, functionally dependent stress analyzer, happiness advocate, actions and repercussions advisor, creator of happiness. I spoke to a colleague recently where a newly qualified counsellor was asking for a reference for her services. She'd previously been my colleague's employment as her cleaner.